Welcome back. Gunderson neurologist Dr. Sunil Mutgi joins us today to talk about stroke recovery. Thanks so much for joining us today.
Thank you.
So we're hearing that there is really an opportunity of time here that makes recovery a little bit more positive. Can you explain a little bit about that?
So we are in a time period now where we have more time than we ever have before. We have our tried and true medication, which we tell everyone that if you have symptoms within 3 hours to come to the hospital quickly. But now we actually have procedures that can be done consistently up to 6 hours. And in some people, when they wake up first thing in the morning with symptoms, can be done even as late as the next morning.
How long do people usually recover from a stroke?
So it's really dependent on when you get to the hospital, and that is why we're trying to get the word out as best as possible to get everyone that has symptoms to get in really fast.
Yeah, go ahead.
And people that have symptoms and get in that 6 hour window, we can sometimes have recovery that can be in less than a week.
What are some of the therapies involved if someone is not knowing of these type of things? What type of things do you use to treat strokes?
So the medication, as I said, is the tried and true, which everybody that gets there in the right time period and qualifies will get that. But now, just like the cardiologists for years have been able to go into the heart and do procedures, we can now actually go into the brain, and we can create recovery by removing clots and having significant improvement on outcome that way.
What are some of the risk factors then that we can maybe prevent ourselves to kind of reduce our risk of stroke?
So we're trying to work with the community. The number one risk factor is hypertension, and that's the American Heart Association recognizes that and has been trying to get the word out for some time on that. So blood pressure is the biggest one.
All right. Well, thank you so much for the great information. We'll be right back with one last look at our forecast.